Good morning and welcome to Southern Cross University's Open Day. Thanks for joining us for our panel for Naturopathic Medicine and Lifestyle Science. My name's Claudia. I'm from the Future Students team here at Southern Cross University and I will be your host today. But before we begin, I'd like to acknowledge that we are on the lands of the Bundjalung people today and pay my respects to the elders past, present and emerging. We're here today to share insights about studying at Southern Cross. This is a 25-minute panel. So today I am lucky to be joined by Andrea Bugarcic, who is a senior lecturer for the National Centre for Naturopathic Medicine, and Isabel Halse, who is both a SCU alumni and current student of the Masters of Naturopathic Medicine. So hi, Andrea and Isabel. Can I start by asking each of you to tell us a little bit about yourself and your connection with Southern Cross?
Sure. Thank you very much for inviting us here. Lovely to be here. So I am a senior lecturer at the Centre for Naturopathic Medicine. I've been here for about 2 years at Southern Cross University. Before that, my training actually is in basic science, and I worked as a postdoctoral research scientist for a number of years and an educator across multiple universities.
Fantastic. What about you, Isabel?
So I studied at Southern Cross back in 2011 when they had the Bachelor of Clinical Science, and then went on to endeavor to finish the degree to get my clinical hours and do a Bachelor of Health Science. And now I'm back at uni doing a Master's of Advanced Naturopathic Medicine.
Awesome. And Isabel, could you tell us a little bit about what naturopathic medicine is?
Yeah, so it's really funny because I actually struggle with this. I have to define naturopathy in assessments often. And I find it a really hard thing to define and do justice in one sentence. Naturopathy, when I was young, I saw the word naturopathy and I didn't know what it was and I Googled it. And the definition was something like naturopathy is using fresh air, clean water, exercise, sunshine, real food, and plant medicine to bring someone back to health. And I remember reading that at 13 and being like, yes, that's it. That's everything. That's what I want to do. So yeah, naturopathy has only been around for about 120 years, but it's really utilizing kind of foundational things such as food, clean air, to remove obstacles in the way of people's health and to stimulate their own self-healing mechanism.
Fantastic. And Andrea, could you tell us what the National Centre for Naturopathic Medicine is and its significance to the practice of naturopathic medicine in Australia?
Sure. So the National Centre for Naturopathic Medicine was established in 2020 here in Lismore. So it's based here in Lismore. I guess the aim of the centre, overall aim of the centre, is really to transform healthcare by using evidence-based naturopathic integrative approaches in conventional sort of healthcare settings, everything from primary care to secondary and tertiary care in hospitals, for example, to really drive better patient outcomes. So we really stand for that by using three-pronged approach. We do a lot of research in the area across multiple research methodologies and research areas. We do education, and we'll talk about that a little bit in a minute as well. But we also do advocacy, so we really drive that message into transforming healthcare out there into communities, to politicians, to healthcare providers, to educators themselves.
Great. And what different courses can you take in naturopathic medicine at Southern Cross?
Sure. So we have launched a few actually courses in the last 2 years, from undergraduate to postgraduate space. So we have an undergraduate Bachelor of Health Science, Health and Lifestyle degree. That degree is a 3-year degree that is able to give you slightly different graduate outcomes that really drive sort of integration into healthcare, healthcare in general. We also have a Master's of Naturopathic Medicine. That Master's is able to provide you or drive you to be a clinical naturopath. If you enroll into a Bachelor of Health Science, you have an option to also complete Master of Naturopathic Medicine. So you can actually, within 4 years, be a clinical naturopath with a Master of Naturopathic Medicine. We also have 2 other master's degrees. One master's is the one that Isabel is actually enrolled in. It's a Master of Advanced Naturopathic Medicine, and it's really geared towards naturopaths that are already in the field that really want to upskill their knowledge or really learn how to do research in their area of interest. And we also have launched this year a Master of Lifestyle Medicine, and that's really driving that integration across different healthcare professions. So we're trying to integrate lifestyle medicine, which is such a big aspect of being a naturopath as well, into healthcare professions across the health.
Great. Isabel, so you are a practicing naturopath. What do you like most about the field?
I feel like being a naturopath is the best job. And I have a lot of friends that are naturopaths because I've worked at detox retreats and this cohort of naturopaths, and we all just love our job. I think the job satisfaction is probably way higher than any other profession. But I think it's probably mostly because we get the privilege of being part of people's healing journey, and we get to see people get better. And a lot of times we see people who have gone through conventional routes of trying to get their health back and hasn't worked, so they come quite hopeless. And so it's really nice to be able to kind of, empower them to get their health back.
Yeah, that's great.
Very rewarding.
Yeah, that's a great answer. And Andrea, where can the degrees take you in terms of a career?
Okay, so I guess the Bachelor of Health Science is one of those degrees that's a little bit more broader than the rest of them. The Bachelor of Health Science degree is as I said, 3 years degree, and really can drive your integration into any sort of health setting. So everything from, for example, being part of a community team where you're a health promotions officer, for example, or somewhere where you're an allied health practitioner. So you're in a team, an actual team where you're helping practitioners do their job. To, if you're really good at communicating, to health writers and communicators. I think, health and science in general really need some really grounded people that really know what health is and what science is. So communicating that is one of those things that you will be able to do quite well after the 3rd year degree. The Masters of Naturopathic Medicine really drives the clinical outcome. So you becoming an actual clinical naturopath. Obviously, that doesn't mean that you only do that. You can still be part of a greater integrative clinical team, as well as do all the other things that a Bachelor of Health Science graduate would do as well. Master of Lifestyle Medicine is a little bit different. Our Masters of Lifestyle Medicine is aligned to Association of Australian Society of Lifestyle Medicine Fellowship. So you are able to, as a health professional, actually acquire a fellowship with ASLM, and you're able to practice or add lifestyle medicine to your ongoing health practice.
Fantastic. And the courses have a strong science background. Could you tell us more about that?
Sure. So the Bachelor of Health Science degree is really grounded in everything body-wise. So you really have to understand anatomy, physiology, chemistry, biochemistry. So everything that's kind of health-related, and then put that into what goes wrong, things around when biochemistry goes wrong, what sort of diseases you can see, when anything in physiology space goes wrong, what sort of diseases you develop. So there's a lot of pathology, there's a lot of understanding of diagnostic space. Diagnostics are very much science-based, so that scientific thinking, that scientific understanding of things around you is really, really important for any health practitioner, including naturopaths. So the health science degree itself is really grounded in all aspects of health science.
Great. And Isabel, why have you chosen to study the Masters of Advanced Naturopathic Medicine?
Yeah, so I've always wanted to do postgraduate study. I love learning. I love being a student. And that's one of the great things about being a naturopath is you never stop learning. There's always new science and evidence coming out, and you always just want to learn more for your patients. So I had 2 kids after finishing the Bachelor of Health Science at Endeavour, and I was working casually, and so I wanted to kind of upskill, refresh, specialize, which is what the degree offers. But I also really love the research aspect of the degree. I even considered doing a master's by research, but I really wanted to feel out if research was what I wanted, and because I was feeling called for research, but I hadn't had any experience. So I love that I could do both in the Masters of Advanced Naturopathy. So I could still be, it could upskill me, and then it could also give me insight into research and whether it was something I wanted to pursue.
Great. And what do you like most about the course?
Yeah, so I think, having both, the practical aspect of it really, you get to choose the electives that you specialize in. So for example, I specialize in mental health, and it really gave me the tools and the resources, the really practical information to collaborate, to integrate, and the confidence, because I feel like often what's missing in the current naturopathy studies is the mentorship and the integration of you kind of just get thrown out into the world as a clinician, and so I feel like it really helps to bridge that gap. And then I love the research aspect of it. I'm currently doing the research project now, and I just I'm really finding it incredibly satisfying.
And what research project are you doing?
So I'm looking at naturopathy in disaster health management. So specifically looking at the experience of naturopaths that assisted in the most recent flooding events in northern New South Wales and southeast Queensland. So it's pretty exciting.
Yeah, that's fascinating. And what advice would you both give someone who is considering becoming a naturopath? We'll start with you, Andrea.
Sure. So to me, naturopathy is kind of at a forefront of person-centered care. That it's really almost ingrained in people that are naturopaths, that really are listening to the person. They're really listening to the patient in front of them. They really are trying to drive their health in the way that they want that health to be driven. And I think that is really where I guess the healthcare in general really needs to start going. So I see naturopaths as leaders really in that space. And I think that they have a lot to give to the healthcare as a field, but also to the patients that receive their care. So from my perspective, becoming a naturopath is kind of almost, it's a calling rather than a profession, if that makes sense.
What about yourself, Isabel?
Yeah, I agree with everything Andrea says. I think that we're seeing chronic diseases on the rise and the complexity of conditions. And I think that mainstream medicine has an amazing, important role, but it's really struggling to address the needs of the population. And I feel like naturopathy addresses those needs in such a holistic, complete way. So I really see naturopathy having an incredibly important place in healthcare, and I can see it growing. So I think that it's, if you feel called, if you feel any calling, to just give it a go, and it will become pretty clear whether it feels right pretty quickly. Yeah.
Yeah, fantastic. And I guess speaking of that, naturopathic medicine is gaining traction in medical circles. Can you touch on that?
Yeah, well, I think, we're seeing a lot of integrative doctors and doctors doing training outside of their medical training to kind of know more, because a lot of their patients are coming in, taking herbs, taking nutritional supplements, having success. So I think they're seeing that these things are working and that there's a lot of evidence and science behind them. And because they are limited in their tools with pharmaceuticals, and they have they tend to have side effects. I think they're starting to be more open to kind of what natural medicine and alternative medicine has to offer.
I guess I'll just add to that. I completely agree with what Isabel said. One of the things that is part of Centre's calling or aim, I guess, of its existence, is to really provide that evidence for across the board for naturopathic medicine to be integrated as part of the healthcare profession in general. So, we do research that's really everything from bench to bedside, really, and trying to really understand not just the needs of the patients, but also the needs of the healthcare in general. So I think bringing that evidence into play is kind of, I think it's part of the traction, I guess, that you're seeing with the integration of naturopaths into healthcare.
Great. And does the centre have any exciting research projects that are currently happening?
Oh my goodness, yes. Lots.
We could go on.
We can go on forever. So we do, I guess I can summarize it in a way that we do really do research from bench to bedside, and actually beyond bedside, healthcare in general. So we have projects that are in bench space around antibiofilm, for example. We're trying to figure out if there's any herbal medicines that are novel for antibiofilm formation and treatment. Everything from things like disaster management. Do naturopaths have a role in that? And if there is a role, what is the role in that? We do a lot of advocacy. We have a clinical trial space. So there's a lot of clinical trials that are happening across the board. So we really are, public health facing. We're really trying to really do research across multiple things. So if anyone's interested in research projects, please get in touch. We probably would be able to accommodate all of them.
Fantastic. Well, thank you so much to you both for sharing your insights today. And thank you to everyone for listening to our panel on naturopathic medicine.
Thank you.
Thank you.